We're going to talk about tips and tricks after osteotomy. And what's an osteotomy?
So osteotomy is you cut bone. That always sounds alarming, but bone actually heals really well, and it's generally to address alignment.
So the most common osteotomy that we do is a tibial tubercle osteotomy. So we're just cutting a little piece of bone and we're moving that bone to realign the kneecap. But there's also
The things called high tibial or HTO or distal femoral called DFO. So generally, for whatever reason, your alignment, your leg is kind of crooked, and we make it straight.
So after all these surgeries, you have to rest the bone in order to get the bone to heal. So typically we only want you to put a little bit of weight on your leg because we want to rest it. And we also want to do everything possible to try to get the swelling down. So elevation, an ice machine, compression is really important.
Yeah, definitely take it seriously. And this is not any different in a way than a broken ankle. And you want to really take it easy, because if you take it easy early on and you have less swelling, as you mentioned, then the rehab after that is much easier.
So patients typically take pain medicine for the first 3 to 5 days, but most of our patients are taking other medications that are lower,
Not
like
addictive.
like Tylenol, gabapentin, Celebrex for the first couple weeks to reduce their pain.
And there's a new pain medication that just got approved that's non-narcotic, but also not an anti-inflammatory. So that's very interesting, and we've started to incorporate that into a post-op pain regimen as well.
Well, we want our patients resting. We also want them to maintain as much strength as possible. And there's a number of gadgets that can be helpful.
Yeah.
Physical therapists who have blood flow restriction therapy. There's home stim units, so you can get the quad working more quickly. And we do want patients bending their knee. So despite the fact that we don't want them putting a whole lot of weight on their leg, we do want people sitting like a regular person, bending their knee, because otherwise you're combating stiffness as part of your recovery.
Yeah, it's sort of use it or lose it. So if you don't move your knee, the scar tissue will keep you from moving it. And you sort of have 6 weeks, I think, overall to get going.
And at the 6-week point, that's when we typically see the patients back in the office. And occasionally it's quite alarming to hear what they're doing in physical therapy. We give out a very specific protocol. I tell my patients that they should read it, even though they may not understand every word in there. It's a little bit of PT lingo, but we don't want to stress this repair too much as we're starting to strengthen it.
Right, so you want to do enough, just not too much. The typical Goldilocks in life.